Do you have whiplash or a concussion? What is the difference? Well, continue listening and find out. But first, let me introduce myself. My name is Dr. Kevin, osteopath here at Melbourne Headache Solutions. Now, starting off with whiplash. What is whiplash? Whiplash occurs when there is a significant and sudden force or injury applied to the head and neck. This causes the ligaments, muscles, and joints to move beyond their normal ranges of motion, causing damage to those structures. This can lead to symptoms such as headaches, neck pain or neck stiffness, ringing in the ears, fatigue, as well as some memory issues or cognitive impairments such as, say, brain fog or reaching for words. Now, how much force is needed to create a whiplash injury? It takes about 4.5 Gs or gravitational forces to be applied to the neck to cause whiplash injury. To put that in perspective, a big sneeze is about 2.9 Gs of force. Now, contrasting that with a concussion, similar cause of an injury there, significant force applied to the head and neck. However, the force required to cause a concussion is much higher. Think 70 Gs or gravitational forces to cause damage to cause a concussion. And again, to put that in perspective, a big sneeze, 2.9 Gs of force. Now, this force, significant force applied to the head, causes damage to the neurons in the brain, and this can lead to symptoms such as, again, headaches, short-term memory loss, cognitive impairments, think memory loss, reaching for words, brain fogginess, as well as fatigue, neck pain, neck stiffness, and disorientation or loss of coordination. Now, a few myths around concussions is that you do not need to be knocked unconscious for there to be a concussion. You also do not need to have a direct impact to the head to cause a concussion. These are two very big myths that I see out there that are unfortunately not true. And in fact, 90% of the concussions out there do not result in a lack of consciousness or a loss of consciousness. So putting that all together, there's a lot of overlap with the symptoms between a concussion and whiplash, and that is because in every concussion injury, there is an element of whiplash. However, in every whiplash injury, there is not always a concussion involved, and that is because of the required force to cause an injury. However, regardless of whether you do have a whiplash or a concussion injury, they both need treatment. And the sooner you get treatment, the quicker your recovery will be, and the smaller the chance of there being a more chronic, complex condition as a result of it. Which is exactly what we do here at Melbourne Headache Solutions. We can help you with your with your concussions or your whiplash injuries. So, if you have any questions, or you know someone who's suffering from whiplash or concussion, tag them below or leave a comment down underneath, and we'll get back to you as soon as possible. Thanks for listening. Bye.